We are at Forest Hill residence of UCT. This is where the University of Cape Town, in conjunction with the Western Cape government, were officially launching this vaccination site here to make it possible and also easily accessible for students. And also this will also play a critical role in making sure the band between 18 to 34 years of age will have it easily accessible and convenient for them to come and also vaccinate. The Western Cape has over 38,000 active coronavirus cases up to this point, and also they are about to reach the 2 million mark of the vaccinations that are administered. But I do have the Premier of the Western Cape, Mr. Alan Winde, to try to talk to us about this initiative. Premier, how important is it to embark in these initiatives, especially with other organizations and other institutions?
Thank you. So I think it is very important. Also, now that we've opened up the 18 to 35s, and partnership like a university is really critical. And this one specifically, we're trying to get these partnerships going across the province with businesses or organizations like UCT. And it's critical that we get our numbers up, our vaccine numbers up between now and the fourth wave, which is expected in December. We need to do that for economic reasons. We need to do it so that we can actually have a summer season that our hospitality industries can get back on track. But also, of course, it's in the interests of a university so that they themselves can also get lectures going again. Not everything can happen online, although I think it's changed the world. But of course, we also need to make sure that we're getting those protections in place, and that's why our university is critical. And then, of course, we've got to save or protect our frontline health workers. They've been at this since March last year, and vaccines are definitely showing that we're less people in hospital, less cases severe enough after vaccination going to hospital and protecting from death, and that's critical as we move from now to December.
Speaking of protecting your frontline healthcare workers, the last time we spoke, we were at Mitchell's Plain, where there was a sort of hesitancy towards this vaccine. We also see about, it was last week or 2 weeks ago, people who were protesting, they are labeled as anti-vaxxers who are also hesitant and also adverse to this whole vaccination program. And also, speaking of healthcare frontline workers and also what is going on, what do you say to that kind of grouping of people?
So of course we need to base everything on data and on science. That we've done that from day one in this pandemic. Is we've used the science and we've used the data because that enables you to make decisions. And the data is showing us, the international data is showing us that although it's your choice to get vaccinated, the data is showing us that the vaccinations are protecting you. And what I've asked now is that when we do our weekly digicons, we will start to show you our own data of healthcare workers, because they were the first ones to have vaccines, and what has it been like in the second wave versus the third wave, pre-vaccine and post-vaccine. Let's have a look at our own hospitals and what's it like for people presenting. Are there people that are unvaccinated or people that are vaccinated? What is the difference? We've got to use that science and data. And that's what I'm saying to anybody who wants to make their decision. Look at the data, make up your mind based on the data. But the data for me is showing that we need to get that percentage up. I get so jealous when I see what happens in other parts of the world where they've got their percentages to the right percentage, and now their businesses are opening, their tourism is opening, their economy is opening. That's where we need to get to.
Speaking of opening up the economy, and also, are we still looking at the herd immunity? When are we looking to say, now we have reached a certain percentage and now we can open up?
Yes, absolutely. We've got to get to those 70% odd numbers. I must say that we're also starting to see almost a competitiveness come in our system. So I'm very proud of the Overberg region. They've done incredibly well. I mean, over 60s in the Overberg. They're sitting at over 90% in registrations and vaccination. And then here in the city of Cape Town, it is sort of the Athlone region, that region that really is looking amazing. But we've also got regions that need to come up, and that's why we will zoom in and focus. And then we'll put up partnerships like this tent to make sure that access is there. It's about quick, efficient, slick operation that actually gives confidence to the citizens.
If you do reach your target before the rest of the country, how are you going to approach that?
Well, what I mean, we can already see it from the hospitality side, the tourism side. We've got tourism towns who are saying if we can get to that, we want to advertise the fact that we've got to our percentage, that we are actually ready for business, we're open, we're safe, the whole town. So it's not necessarily about the hospitality industry, because it's about everybody, you know, and that's why we've worked really hard in this province. Whether you're a homeless person, whether you're a foreigner that's visiting us here in the country, or whether you're a citizen in business or even unemployed, it doesn't matter. Whoever you are, as Minister Mbomba says, we will come and create a facility for every single person. No one must be left behind. Everyone must be given that opportunity.
Thank you so much for your time.
Thank you.
Premier of the Western Cape, Alan Winde, talking to us about this newly open vaccination center, which they were launching here in conjunction with the University of Cape Town, saying of course they are looking for other institutions and other private corporations to try and come and get on board so that they can ramp up the vaccination. But saying of course this is not only a matter of a health issue, but it has become an economic issue. So he is pleading and also calling on people to come and vaccinate so that they can deal with this matter and put it behind them.